Today we have an enrollment event from 9 a.m. to 5 p.m. We're inviting everybody out to learn more about the Affordable Care Act. They can get their questions answered. They can talk to an agent. All of this is at no charge, and they can get signed up for health coverage, which is going to be required to do this year by March 31st.
What kind of response have you had so far?
We've had a great response. People have been coming out since before 9 o'clock this morning. We've had over 100 people, and everybody is very enthusiastic.
What are some of the typical questions that you're getting from people?
Some of the people are asking, do they qualify for a subsidy? What kind of options do I have for my family? How old do I have to be on my parents' policy? When do I age off of my parents' policy? Questions like that. And the agents are all certified in the ACA, and they can answer all of these questions.
What is the deadline for people signing up for health care?
If people want to get health care on the health insurance marketplace, which is the only way that you can qualify for a subsidy and get assistance paying for their coverage, then they have to get signed up by March 31st.
Is this a complicated process?
It is complicated in the sense that this is the first time that it's been offered this way. It's the first time for Blue Cross and all other health insurance companies, and it's the first time for consumers. So it is complicated in the sense that there's a lot of unknowns, but we're here to help. We are very excited to have Miss Louisiana, Jaden Leach, join us today. She's here to help encourage a lot of our young people in Louisiana who are over 26. Up until age 26, you can stay on your parents' coverage. Beyond that, you will need to get your own policy, and there's a lot of choices out here, and she's just a great example to the youth of the state.
What do the statistics show regarding young people and health insurance?
Well, they're called young invincibles for a reason. They feel like they're a little bit bulletproof, but really, it's the law, it's a requirement with this new healthcare reform law that they get the coverage by March 31st. So they do need to comply with the law, and it's also a great way to protect you financially should you have any chronic health issues or accidents.
I'm here today basically to be a role model for younger adults on to get health insurance and the importance of that, and to sign autographs and just to meet people that are here inquiring about getting health insurance.
Why is health insurance important, particularly for young people over 26?
Well, health is important first and foremost. That's always the first thing to remember. And secondly, we want to be in good health. We want to know that if we get sick or something happens, we can always lean on that health insurance. So basically, everyone needs health insurance, but I'm really here to help convince those that are right over the age of 26 the importance for young adults to have that as well.
What's your experience in this area with health insurance?
Well, I came here actually about 6 weeks ago and talked to Blue Cross Blue Shield about what I can do as a young adult to help convince other young adults to get health insurance. And we talked about just what we just talked about once again, the importance of it. And so I know that I can be an example across the state of the importance of health insurance.
Young adults are one of the categories of health insurers that we would like to get health insurance for obvious reasons. They are what we call the young invincibles. They enter the risk pool and they help offset the older, sicker population.
And tell us, what's the sign-up rate for those folks over 26 and through their 30s?
Well, I don't know the exact rate offhand. It'll be just dependent on what product that they choose as to what rate they would get. But we are, Blue Cross put over 200 different variations of health insurance plans out there so that we could have one that fits everyone's needs.
What's your best advice for people when it comes to signing up for coverage before the March 31st deadline?
Definitely get coverage by March 31st. The key is to get with an agent or broker, an expert, because this year, more than any other year, it is going to be quite cumbersome and a bit of a challenge to navigate through the healthcare website and through the health insurance purchase process.
It's exciting. A lot of people are showing up. It's very obvious that we have a need for people to be signed up under the Affordable Care Act, and Blue Cross and its community outreach effort to provide information and get people the information they need. It is a great thing. To see the excitement in the air around this Blue Cross facility, it's certainly been wonderful.
What is the importance of people getting information between now and March 31st?
Well, they know exactly what it takes for them to get signed up under the Affordable Care Act for insurance, and the requirements under the Affordable Care Act that people need to be signed up if they qualify. For them to have the information they need to make intelligent decisions is very, very important.
What kind of response have you got from the people that have come out here today?
It's wonderful. I mean, those that are being able to sign up are signing up. Those who need just information are getting their information provided to them. So it's been wonderful, and I'm glad to hear that the people are leaving excited about what they have to do next.
The main question we're getting is, do I qualify for a subsidy? How do I know if I qualify for a subsidy? One of the questions recently was, I'm a student on a student visa. Do I qualify for a subsidy? So really, people are just trying to make sense of this complex law, and that's what we're here today doing.
How do the subsidies work?
Subsidies work. They're for people who make 100% to 400% federal poverty level. They're actually a premium subsidy. It just reduces the premium that you pay for your health insurance on a monthly basis.
And how does that translate into a yearly income from the average person?
Well, for a yearly income, for a family of four, that's up to $92,400 a year. So what you can see is that it's a broad range of people who would qualify for this subsidy. So through the government programs and the qualifications, as long as you don't have affordable coverage to your health insurance employer, you could potentially qualify. And so that's what we're here today, is trying to see what people would qualify for, if they qualify for anything, and get them signed up for a policy.
The Affordable Care Act requires most people to have insurance this year, and if they don't, they will be penalized come next tax season, either 1% of their salary or $95.
What's the best way for people to avoid that penalty?
The best way to avoid that penalty is to get signed up by March 31st.
I've been very happy with the turnout. People have great questions. People are just looking for answers, and part of what we do here today is to help get some of those answers. And we've got a really great turnout. We look forward to the turnout through the rest of the day.